Hello, my name is Arjun Gupta and I'm a former researcher at the Mayo Clinic in Rochester, Minnesota and a resident physician at the University of Texas Southwestern Medical Center here in Dallas, Texas. In an upcoming issue of the Mayo Clinic Proceedings, our research group is publishing an original article titled Extraintestinal Clostridium difficile infections, a single-center experience. C. difficile is a bacterium that normally resides in the human colon. It is now the leading cause of hospital-acquired infection in the United States. Although C. difficile is well recognized as a cause of intestinal disease and diarrhea, there are infrequent reports of it causing infection and disease outside the gastrointestinal tract. We assessed all cases of C. difficile infection outside the gastrointestinal tract seen at the Mayo Clinic over a 10-year period from 2004 to 2013 in order to understand the clinical associations, risk factors, management, and outcomes of these rare infections. We identified 40 patients with extraintestinal CDI, the largest reported cohort from a single institution. 20% of cases were reported in the last year of the 10-year survey. This increase might be mirroring the overall increase in intestinal CDI disease burden and severity. Infections in the abdominopelvic area and bloodstream infections were most commonly identified. Risk factors associated with extraintestinal infection included recent hospitalization, a surgical manipulation of the GI tract, antibiotic exposure, proton pump inhibitor use, and malignancy. About half the patients also had diarrhea, and 2/3 of them tested positive for C. difficile infection in the intestine. Toxin-negative C. difficile strains have been shown to cause disease outside the GI tract, although exact pathogenic mechanisms and virulence factors responsible for extraintestinal disease remain to be defined. No treatment guidelines exist for extraintestinal CDI. Management of these infections included antimicrobial agents and surgical procedures such as drainage of abdominal abscesses, paracentesis, or wound debridement as clinically indicated. We found that early infection-associated mortality was high at 25%. No cases of recurrent infection were recognized. Overall, an aging immunocompromised population with high exposure to both antibiotics and proton pump inhibitors and who undergo more frequent hospitalization and surgical procedures may be more susceptible to extraintestinal Clostridium difficile infections. Our article summarizes the risk factors, management, and outcomes of these rare infections seen in the largest yet cohort of extraintestinal CDI. Thank you for the opportunity to present this material.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.